We are keeping health first as today marks National Rural Health Day, dedicated to recognizing the hospitals, the clinics, the care teams that serve people in rural communities. And today a rural health fair will be held in Burgaw. I'm joined by Dr. Andrew Justice from Pender Medical Center. Sir, good morning. Thanks for being here.
Absolutely.
Let's talk, obviously there are obstacles. Let's kind of lay those out first and foremost.
Yeah, I think Pender County is very similar to Brunswick County. The county on the coastline, you have a higher density of people with different socioeconomic resources, easier to get to places. But once you get about 3 to 4 miles off of the coast, it is rural farming country, and it's very different than being in Wilmington. So I think just the vastness we serve. So at Pender Medical Center, we're getting patients from Onslow County, from Duplin County, and from western Pender County. So for patients to get to us, it's often 30 to 40 minutes, and then to get into Wilmington would be more. And I think even beyond that, the number of providers is going to be less, the number of clinics is going to be significantly lower, and the number of specialists. So there is no surgeon operating in Pender County right now. There is no obstetrician or gynecologist. You cannot deliver a baby in Pender County at this time. Multiple times this year, there's been a baby delivered in the emergency department because the patient, they could not make it into Wilmington. And so it's one of those things that.
And it's a problem that snowballs because more and more people are moving to these rural counties. It's not going to be rural forever, right?
Exactly. Yeah. And so the other thing too is the patients. It's not just the providers and limited resources. If you don't have transportation in rural Pender County, you can't get to the hospital. It's very different if you're in Wilmington, where you can get a bus, you can actually walk to a clinic. So it's just a lot more obstacles.
So how does the hospital help kind of bridge that gap?
Yeah, so we work really hard to figure out what resources we need for the community. We work really hard to say, how can we let patients get taken care of in our community, in our space? So we look at what we need. So if you're a patient in Pender County and you're on dialysis, there is no hospital that can take you in Pender County. If you're in Duplin County, the same thing. So you have to go an hour and a half all the way into Wilmington, maybe even to Greenville, somewhere like that, to get dialysis services. There is no MRI machine in the entirety of Pender County. So stroke care, we cannot do anything about that. And so our job is to focus on these things. How do we get surgery services out there? How do we get GYN services? How do we get better imaging services out there? How do we take care of our stroke patients? We have a high burden of stroke and coronary artery disease patients, and how do we find the ways to get the resources out there?
And unfortunately, as an individual patient, you can't use those obstacles as a mistake to ignore your own health symptoms.
Exactly.
Yeah. What's the big takeaway?
The biggest takeaway is just because you live in a rural place, it doesn't mean you have to be any less healthy. So we are working and doing everything we can to get all of the resources to the people in the rural areas and have Pender Medical Center and other medical centers, Brunswick Medical Center, be able to take care of these patients where they are in their own community so they can live as healthy of a life as they can.
Doctor, we appreciate the input. Thank you very much. And
Absolutely.
Again, we've got that graphic up one more time. The health fair is at 11 o'clock this morning at the Pender County Health Department there on South Walker Street in Burgaw.